Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the side effects from corticosteroids. Corticosteroids are also called steroids. They have many uses, from the management of arthritis, in the management of bronchial asthma, in the management of autoimmune diseases, and also in certain skin diseases. Adverse effects is also used in place of side effects. The steroid has many side effects, and physicians should always consider the advantages over the disadvantages before prescribing the corticosteroids. So the side effects include the following, like osteoporosis. The steroid suppresses intestinal calcium absorption, inhibits bone formation, and decreases sex hormone synthesis. Patients are advised to take calcium and vitamin D supplement. Patients may need osteoporosis therapy. Pathological fracture may happen due to osteoporosis. Bone is very fragile, so just change in body posture with minimum force sometimes may cause fracture of the hip bone. Just falling on the ground with minimum impact may lead to hip fracture. As because the steroid suppresses the sex hormone, so there will be male impotence, and female and male infertility is also possible due to continual steroid intake. Cushing syndrome, redistribution of body fat, especially fat under the skin in the subcutaneous tissue. There may be moon face, growth of hair in unsightly places, we call it hirsutism, acne, insomnia, there may be insomnia, and increased appetite. Increased frequency of cataract and glaucoma. Cataract means opacity of the lens. Glaucoma means increased intraocular pressure due to the excessive accumulation of aqueous humor without drainage. Side effects from corticosteroid continued, like hyperglycemia and diabetes mellitus. Blood sugar should be monitored, and diabetic medication need to be adjusted because blood glucose level became higher and higher due to steroid intake. Hypokalemia, the low level of potassium, may need potassium supplementation. Increased risk of infection and delayed wound healing, that is a problem. The leukocyte may not go to the area of infection, and immune system may be suppressed due to corticosteroid use, although it is used in the management of inflammatory conditions. Emotional disturbances, euphoria, person has a sense of well-being, depression, even suicidal tendency is more in a patient who take corticosteroid. Hypertension, blood pressure will be high due to retention of fluid, high blood volume, and that may lead to hypertension. Edema, again there will be interstitial fluid will be high, there will be edema. Peptic ulcer, there may be ulceration in the stomach or duodenum. There may be sometimes perforation of the stomach or duodenum, may lead to peritonitis. Okay, these are the images I have taken from Microsoft PowerPoint online picture. There will be decreased growth in children, so stunted growth, glaucoma, increased intraocular pressure, centripetal distribution of the fat, will have central obesity. The limbs will be very much narrow, since a person is walking on two sticks. Osteoporosis, there may be chance of pathological fracture, increased risk of infection, WBC may not function properly, hirsutism, excessive growth of hair may be in the unsightly places, increased appetite may be beneficial to some patients, especially patients with anorexia and cancer. Emotional disturbances may be euphorious sense of well-being. Depression may have suicidal thought. Peptic ulcer formation, there may be perforation of the stomach or first part of duodenum. There may be peritonitis. And blood pressure may go up. There will be peripheral edema. And there will be hypokalemia. Potassium may be low. Okay. So muscle wasting and central obesity is also a possibility. So there will be central obesity, but the muscles of the limb and the leg and hand and the lower extremity, upper limb, lower limb will be wasted. Decrease drug interaction, that is very common because a lot of drug goes through the liver metabolism. The steroid itself also goes through liver metabolism. Co-administration of medication that induce or inhibit hepatic mixed function oxidases may require adjustment of steroid doses. Steroid withdrawal syndrome is very important. HPA axis, that is hypothalamus, pituitary, adrenal axis is suppressed. Abrupt removal may cause lethal acute adrenal insufficiency because it takes time to produce the steroid by the body once the body is under exogenous steroid. So abrupt removal may cause lack of steroid in the body that may lead to adrenal insufficiency syndrome. The dose must be tapered based on trial and error, otherwise this person may die. And that's all about the adverse effect of steroid or corticosteroid. So if you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.